Bottom line, now that you've seen the CBO report, what does it mean for you in terms of the potential for you to vote for or against this health care bill?
Well, I've seen the headline of the CBO report. 22 million would come off the insured rolls. I think that's a significant concern for all of us. So I've got my homework. I am going to add this to the time that I spent this weekend reading the full bill, but to be able to study the CBO report is important. Right now, I've got a lot of discrepancy between the numbers that we see from the state versus what we've got from CMS. I'm trying to get some serious answers to some really very serious questions.
And the White House just put out a press release saying that CBO can't be trusted because their analysis and predictions about what Obamacare would do turned out not to be the case. Do you agree with that? Or I mean, how much weight are you putting in the CBO analysis that does show 22 million people would lose health insurance?
It's not just the CBO analysis. Again, Alaska is such an outlier in so many areas. The CBO analysis is the nationals. I want to make sure that I understand what this really means for the people that I work for back home. So I'm going to get the numbers, and if I can't get the numbers, it's really tough for me to make a fair and a balanced evaluation as to this bill. So I'm going to dig for them. I'm going to try to get the numbers. I'm going to insist on getting the numbers. Let's put it that way.
So at the end of the day, you talk about your state of Alaska, which is obviously unique. There are a lot of constituents that you have who have come to rely on this kind of coverage. What is going into your decision making on how to vote for this, or what you would like from the leadership in order to get your vote?
Really, my views have not changed in terms of the things that I'm focusing on. I want to make sure that those that have the benefits that come through Medicaid and now Medicaid expansion are able to see that a level of continuation of care. I want to make sure that a state that pays the highest costs for our premiums, so far and above any other state out there, that there is some level of balance and equity. Right now, making sure that the tax credits are something that work in a high-cost, low-population state like mine. So it's making sure that access is continued, and you all know that I have been a supporter of funding for Planned Parenthood. In my state, that's access for women. So making sure that access is continued, that costs come down, and those that have received the benefits that we have clearly seen in Alaska and around the country with Medicaid expansion are those benefits are continued.
You mentioned Planned Parenthood. That was something I was going to ask you about. This bill just cuts federal funding for Planned Parenthood for 1 year. What does that do for you?
That concerns me.
Will you vote for something that does that cuts it at all?
You know, what I have said very clearly is that I don't think that the issue of Medicaid reimbursement for Planned Parenthood should be an issue in this bill, and I still feel very, very strongly about that. And if we have to get to a point to offer amendments, I would move to strike that.
At this point in time, given what you said you studied the bill this weekend, I know you're going to study the CBO report. If you have to vote today, how would you vote?
Today, I don't have enough information. I don't have enough data in terms of the impact to my state to be able to vote in the affirmative. So I'm trying to get the information. I think that in fairness to Alaskans, they deserve that information. This is big stuff. And so making sure that we get it right is something that I have said is an imperative. I don't think it's asking too much to say, give us the time to fairly and critically analyze these numbers. And if you're saying, well, CBO numbers don't matter, then let's look at the numbers that you think do matter. But it really does. It does make a difference. These costs and these numbers that we're talking about, these are men and women. These are our families that are being impacted. So let's please get it right.